The DOH is still monitoring a 5-year-old Chinese boy who is suspected to be the first carrier of the new coronavirus here in the Philippines.
Still, Health Secretary Francisco Duque sees no need to declare a travel ban on China. Greg Gregorio with the report.
A 5-year-old kid from Wuhan, China, who traveled to the Philippines via Cebu, is now the subject of a probe by the Health Department. Upon arriving last January 12 with his mother, the child already exhibited flu-like symptoms linked to the new type of coronavirus.
To make arrangement to study English in Cebu. And they will be going back after the arrangement had been made.
The patient remains isolated as his colds and cough persist. The kid tested negative for the Middle East Respiratory Syndrome coronavirus or MERS-CoV and the Severe Acute Respiratory Syndrome or SARS. His samples, however, tested positive for a different type of coronavirus. The kid's specimen has been sent to Australia for further testing.
Since we have a new or a novel coronavirus now, probably there needs to be more specific tests to identify the strain.
The Quarantine Bureau had also traced the kid's co-passengers on the plane, at least those who were closely seated to him. No one displayed flu-like symptoms. The Bureau will meet with airlines Wednesday to discuss precautionary measures.
We will be issuing the audio regarding this virus that passengers who are experiencing flu-like symptoms like cough should report to the Bureau of Quarantine upon arrival.
Meanwhile, 3 Chinese nationals in Kalibo Aklan, initially suspected of carrying the virus, have already been cleared by the DOH.
The signs and symptoms did not fit the case definition as prescribed by the WHO's interim guidelines on the new coronavirus.
According to the World Health Organization, those with a travel history in Wuhan, believed to be the virus's ground zero, should inform their clinicians.
At this point of time, you don't need to be anxious unless you have traveled to Wuhan. That's what it points to.
Health Secretary Francisco Duque sees no reason to declare a travel ban on China and even assured readiness to deal with the novel coronavirus. For now, the public are advised to wash their hands frequently and cook their food properly. For News 5, Greg Gregorio, we are One News.
American health officials confirmed the U.S.'s first case of the SARS-like virus that has been plaguing central China. The U.S. Center for Disease Control and Prevention, or CDC, said the patient is a 30-year-old man who traveled to China and arrived back in Washington State on January 15. Officials say the man immediately sought medical attention after hearing about the virus on the news. He's currently in good condition, but remains in isolation as a precautionary measure. Last week, the CDC began screening travelers from China in 3 U.S. airports.